Well, technology is always changing, but it's always changing to the best. I think that we're living very exciting times in plastic surgery because there's a lot of nice things coming out. For example, a few years ago, harmonic scalpel came out. That was a great technology advance in plastic surgery because now we're not damaging tissue. Patients are healing quicker with a better and more comfortable recovery time. Now let's go into some techniques. For example, you can have techniques where you can do fat injections. It's been around for many years, but it's changed in some ways with the use of different techniques. So fat cells now can live longer in the right location. Then we found out with technology that fat cells are high in stem cells, for example. So for many years now, a few years, we've been injecting fat cells to cheeks and to the face of patients. As you get older, you lose a lot of that fat on your face and it starts sinking in and it starts looking more skeletal and you lose that fullness of a youthful person. The beauty, the initial beauty when you were younger starts going away slowly. All that is your fat cells just going away, and that's part of your genetic code. So how do we change that? We can inject, fat cells that have stem cells in them. Every fat cell has a high quantity of stem cell in them, and that's been proven. So how am I fixing everything? The way I fix it is by injecting fat cells. Beware of where to inject the fat. I can inject your face and your results will be wonderful with the right technique. But with the wrong technique, you can cause deformity. So you have to be careful who you choose to inject your fat. I'm well trained in doing fat injections on the face and other parts of the body. Now on the face, it works really nice because not only does it plump up your face, but it also fixes a lot of the sun damage. The stem cells can go right through and improve the texture of your skin. So it has longer effects that happen and keep happening for years after the injection. But then you go to other parts of the body, for example, breast injections or buttock injections. In the buttock, it's very popular. It works really good. It gives you nice round results and it could be a lot permanent. You lose some, but you gain a lot more with the right technique. Now there's some other areas that are very controversial. There's not a lot of studies out there, which is breast injections. Beware of the breast injection. The problem with the breast versus all the other parts of the body is the cancer rate. There's a lot of cancer that comes out of breast, and stem cells is like adding fuel to the fire. You have to see the studies and you have to see initial studies coming out. You have to be aware. Me personally, I wouldn't do that. I would do it just to revise some other cases after reconstruction, after mastectomy, for example, but not as a primary augmentation. You have to be aware of what some doctors who are not board-certified plastic surgeons are doing with these techniques, which have not been proven yet. Other than that, I think that the technologies are changing in many other ways with the use of the pain pumps, with the use of injectables. The fillers nowadays that we use are very good and they last a lot longer. A lot of them are even reversible. You inject somebody on the cheeks with hyaluronic acid or the different brands that we can use. But the advantage of that is that you look great, but if for some reason you have a little bit of extra on one side or the other side, you can reverse it. No damage done. So you have to really do your homework and make sure that whoever is doing your injections, whoever is using all these new technologies, really know and they have trained in the use of this technology.